I'll start. Good morning, everyone, and happy Republic Day to all. I'll give first short intro of what is our IIPWC, and then we can proceed further. IIP Women's Cell functions under the guidance of our national head,
And happy
Dr.
Republic
Ruchi
Day to
Varshney.
all. I'll give first short intro
Madam,
of what is
you
our
can
IPWC.
switch off the other
Then we
thing.
can proceed further.
You are listening it?
IIP Women's Cells
Yes.
functions under the guidance of our
It's recording, sir.
national head and happy Republic Day to all.
Ma'am, you can switch off your, I think you have on two. Switch off the other
We
thing.
can proceed further.
You are listening it?
IIP Women's Cells functions under the guidance of our
Recording, sir.
national head and happy Republic Day to all.
I think I have switched off,
Ma'am,
sir.
you can switch off your, I think you have on two. Switch off the other thing.
We can proceed further.
You are listening it?
Just a sec.
Switch off the YouTube channel, Deepika.
I think I have switched off,
Ma'am,
sir.
you can switch off your, I think you have on two. Switch off the other thing. You are listening it?
Just a sec.
Switch off the YouTube.
I think I have switched off, sir.
Hello.
Hello?
I think somewhere other is going on, sir.
Deepika, it's fine.
It's fine. Shall I start?
1 minute, ma'am. I'll give a little introduction and then you can start, okay?
Oh,
Yeah, so good morning, everyone. A happy Republic Day to all who have joined here. And myself, I am Dr. Srinivas Nayak from IAP Digital Media team. I will be the host for today's webinar. The webinar is on role of physiotherapy in pregnancy and beyond with resource person Dr. Reema Ranka. This is organized by IAP Women's Cell Women's District Maharashtra State. And Indian Association of Physiotherapists is the oldest and largest association representing the physiotherapist in India since 1955. And IAP Digital Media team consists of a group of physios who handle Zoom platform and webinar live streaming and IAP profiles across the social media platforms like Facebook, Instagram, Twitter, and LinkedIn and YouTube. So I request all of you to please follow the IAP social media to receive the notifications about our events, webinars, workshops, CMCs, other recent updates on physiotherapy. So subscribe to our YouTube channel also, where you can get the recent advances. And in the YouTube channel, we have segregated the webinars based on the topic and over to the organizers.
thank you, sir. I'm giving a short intro of our IIPWC. IIP Women's Cell functions under the guidance of our national head, Dr. Ruchi Varshney, and IIP President Executive Dr. Sanjeev Jasal. We have 5 zones in India with heads for each. Dr. Pooja Kamble ma'am is the West Zonal Head. The state team of IIP Maharashtra includes Suvarna Ganvir ma'am, Joint Coordinator Dr. Snehal Patel, State Coordinators Dr. Uttara Mohan, Nirali Sangvi, and Dr. Priya Karande. In Maharashtra, IIP Women's Cell has conducted many low-cost activities like CME, workshops, public awareness campaigns, health camps, blood donation camps in various districts since 2018. In the year 2021, 22, 23, IAPWC Maharashtra has received award for Best IAP Women's Cell State Team. Today's webinar is on role of physiotherapy in pregnancy and beyond with the resource person Dr. Reema Ranka, and it is being conducted by IAP Women's Cell Mumbai District. Dr. I myself, Dr. Deepika, is the Mumbai District Coordinator, and Reema and Dr. Urvi Katakia are my sub-coordinators. I'll give a short intro of our today's resource person, Dr. Reema Ranka. She is a women's health physiotherapist, Lame's childbirth educator, antenatal and postnatal fitness expert, lactation consultant. She has more than 11 years of experience working with maternity hospitals and in and around Mumbai. She is the owner of Reborn Physiotherapy and also an influencer on Instagram named Dr. Reema's Reborn. She has been awarded as first IAP Women's Health Conference for the same. She has an international publication on awareness of PCOS and menopause. She is also our district sub-coordinator. Welcome, Dr. Reema. Over to you.
Hi, everyone. Thank you for this wonderful introduction, Dr. Deepika. So, first of all, good morning and a very happy Republic Day to all of you. I'm so glad that all of you took out time this morning to sit and listen to what is the role of physiotherapy in antenatal and postnatal care. So before beginning, let me tell you, this is not going to be a webinar. It is more like a meeting where I want you to also discuss with me and ask me questions with whatever doubts you have in your mind over the years over practicing women's health. Okay, so before beginning, I want to know how many of you here are already practicing uh, women's health in your clinics or in some hospitals or anywhere. How many of you are practicing? You can just type me in the chat box maybe. See the chat box over. Okay, so let's begin. Let's begin. What is the role of antenatal and postnatal physiotherapy? Like we all know, pregnancy is one very important phase in every woman's life. And pregnancy is not just pregnancy, the time before that, the time after that, the entire transition from, being a little lady to a woman, from being a person to becoming a mother is a huge responsibility on yourself physically as well socially, and that is why physiotherapy plays a very important part. I would say not only in pregnancy, it is a lot to do even with pre-pregnancy, a lot more to do post-pregnancy. जब लोग बोलते हैं women's health physiotherapy, what comes to your mind usually is that you think that we should be talking only about a certain aspect, or we should be talking only about how what should we do in pregnancy, what exercises we should give in pregnancy. So I have so many physiotherapy friends or colleagues who just call to us that kya exercise dena hai pregnancy mein. But trust me, it is not about just giving an exercise. सिर्फ एक एक्सरसाइज दे के आप छोड़ दो वैसा नहीं है. You have to thoroughly see everything, every report, every small thing, because it's not like a normal person who is coming to you for a neck pain or a back pain that you can just prescribe some exercises randomly. So first thing that comes with women's health physiotherapy is you will have to be absolutely thorough with the anatomy, physiology, gynecology in depth. You should be knowing how to read the reports very well, because of course the patient will not be knowing that if they have a low placenta or a high placenta or placenta previa, or so yes, all these words you should be knowing. Okay, now when you get pregnant, it's not just the neck pain, back pain. There is a lot of changes happening in every part of a female's body, right from, you can say, the neurology, which means the person might be very forgetful. There will be changes in her brain, there are changes in her kidney, in her heart, in her muscles, in her endocrine system, even the respiratory system. And that is why in women's health physiotherapy, breathing also plays a very vital role, which I'm sure many of you are aware of, that breathing exercise is something that we do in the labor room. So if you have a doubt, okay, what is the role of a physiotherapist in the labor room when someone is delivering, someone is getting delivered? So exactly what should you be doing? You should be giving them breathing exercises. You should be teaching them breathing exercises from before and training them how to do them when they are in that labor pain phase. Okay. Now, first, let's go to the musculoskeletal changes. So, not only the body changes, there are hormone changes, there is an increase in the body weight, there is increase in the size of the abdomen due to the growing size of the uterus. Now, more important than that, so if when a female is walking into your clinic with pregnancy and she's telling I'm having a back pain, there are many small things that you have to actually look into, that you have to actually take care about, because these hormonal changes are going to bring an increase in joint laxity and ranges. So when you're giving them exercises, you have to be extra careful, because already because of pregnancy, the joints are going to be more lax. So if you're going to give overstretching, that is again going to be wrong. There will be water retention, there will be edemas, there will be nerve compressions. So you can expect a lot of sciatica, carpal tunnel syndrome, and all these nerve kind of problems are very common in pregnancy because of water retention. So you have to explain the patient that this is something very normal. Water retention is expected in pregnancy. It is normal. Your nerve is getting compressed. It is normal, and we can get it treated. Pelvic floor dysfunction. I think this is the most underrated problem in pregnancy, that females feel that it is completely okay to keep leaking in pregnancy, which is not. Leaking is a problem which happens when your pelvic floor is getting very weak, and that is why Kegels is one key exercise that has to be started from the antenatal period and to be continued till your postnatal period, so that you can have a proper pelvic floor. There will be muscle cramps. Again, you have to explain the patient that these muscle cramps are expected and they can happen. So if you're giving exercises, you have to make sure you're giving adequate breaks, the patient is having adequate water, the patient is not overexerting, taking some proper cool down time, because otherwise one day you are going to give her exercises, second day she will never come because the muscles are going to go into cramps. Then there is muscles, bones will go into osteoporosis, which is because of pregnancy. So when you're giving exercises, you have to tell her that she has to be sure that everything that she's doing has to be done with support and not without any support, because osteoporosis becomes very much in pregnancy. There is a chance of falling and breaking bones, and healing or treating fractures in pregnancy is a very difficult thing. Okay? So these are the few things that you have to be careful about. Of course, diastasis recti is one major role that we have to play post delivery. Okay, diastasis recti is when your two muscles which are in front of your stomach, that get torn apart at the time of pregnancy. Now, if you go to any gym, any yoga instructor, everyone will give you weight loss post delivery. They all will help you with that. They all have sessions for that. But I think treating and correcting diastasis recti is something what only physiotherapists can do, and only we have this beautiful power to check exactly how much diastasis recti a female is having and how to get it corrected. So that is absolutely our role. And I think as a women's health physiotherapist, if you are not so confident about practicing pregnancy, at least post delivery cases, if you're seeing, you should always check the diastasis recti before treating any condition in the female, because be it back pain, be it hernia, be it neck pain, be it weakness of the lower limb or of the upper limb, if you're not going to check the diastasis recti, you will never be able to treat her completely, because the base or the core or the main reason of whatever difficulty she's having is this diastasis recti. And diastasis pubis. Diastasis pubis is many post-delivery females will come to you with tailbone pain, a vagina pain, a sharp shooting pain. So all of these conditions are diastasis pubis. I'm not going so much into the technical terms, because I believe all of you are already well-established physiotherapists who know a lot about everything already. Now, if someone is coming to you in early pregnancy, okay, they've just come, it's early pregnancy. So what is it that you should be doing for them? what should it be that you should be guiding the person? I'm first covering antenatal part. Ki, chalo, they are not yet pregnant. They're in the planning phase. So, as a physiotherapist, what do you think you're going to guide them about? Anything that you're going to guide them about? You can put it in the chat if anybody knows that what are you going to guide if someone is coming to you in a prenatal phase, not yet pregnant. So as a physiotherapist, आप क्या बोलोगे उनको? So as a physiotherapist, you should be at least having knowledge that how she should already work on her posture, which is very important because most of the pregnant females later come to you with, I have a posterior placenta. Placenta is very low. What is the reason? That pre-pregnancy, they did not take good care of their posture. उससे भी ज्यादा important. I think stay active, lower limb strength training, very good. Also, very important that you, as a doctor, guide them about their multivitamins or the essential multivitamin that is required in the pre-planning phase. Which is that multivitamin? One multivitamin that you should start at least 3 months before you start planning. Folic acid, right? B12, folic acid, all of you know that. So when a pregnant female or trying to conceive female is coming to you, make sure that you're also giving this information, that you're working on your B12 levels, you're working on your folic acid. One more very important fertility medicine, I would say, is vitamin D3. Because if your vitamin D3 levels are low, I don't know how many of you are aware of this. If your vitamin D3 levels are low, the egg quality will be bad and the sperm quality will be bad. So B12 may be for women, but for men and women both have to start a course of vitamin D3 at least 3 months before you go into the conceiving phase. You have to start eating clean. You have to stop smoking and drinking, that goes without saying. So this all lifestyle modification things also comes under the umbrella of a women's health physiotherapist. You have to sit and explain her that exactly what she should be doing, which vitamins she should be taking, what tests should a woman do when she's trying to get pregnant. Maybe she's tried 2 months, 3 months, 4 months, but she's not yet got the result. So what is the test that she should be doing? Why you should have all this knowledge as a women's health physiotherapist is when a female is coming to you, she knows that you're a doctor. She does not classify you as a separate, that only exercises she's going to show me. No, even lifestyle modification, even prescribing tests, even giving the basic multivitamins, everything comes in our umbrella. So what are the two tests? Chalo, tell me one test that a female should be doing if she's trying to get pregnant and she's not getting the result for a very long time. I don't know how many of you are aware of this. It is known as the AMH or the anti-Mullerian hormone. Along with all the other hormonal tests, you should tell her to check her AMH, which should be the anti-Mullerian hormone, which tells us about the egg health, whether it's in the proper condition or not. ठीक है, तो उसको AMH check करने बोलो, tell her to take her D3 and B12 vitamins and then start working on her lower limb, start giving her exercises if she's a female with PCOD or PCOS. Then your focus should be on giving her strength training exercises and not cardio exercises. This is my own research published in the International Journal of America, that strength training is the most effective exercise for PCOS. Okay, so I think you have your key takeaways for what do you do when you have a person who is coming to you pre-pregnancy. You will work on the strength, lower body strength for the female. You will work on the core strength for the males. Please remember, you have to work on the core strength and the pelvic floor strength for the males. You have to give both of them D3 medicines. You have to give B12 medicines to the female. And of course, lifestyle modification and clean diet and healthy living and all of that, no smoking, no drinking, all of that. Okay, so that is pre-pregnancy for all of you. Now I'm coming back to pregnancy. So the first thing that you will explain her about is, pregnant ladies, they have a habit of keeping both the hands behind and standing like this. Even before they are at least 4 or 5 weeks, I think naturally they start going into this posture without even them thinking or realizing that it is actually harming me in the long run and this is going to be bad for me and my baby. They do not give so much thought about it. But so you have to always explain them that when you're going to stand, like you can see in this picture, when you're going to stand with a lot of, keeping your both hands behind, and when you're going to increase your lordosis, you have to explain this pre-pregnancy, you have to explain this in pregnancy, maybe use a chart or something to explain them that how just standing like this is increasing your pelvic tilt, and how it is stretching your weakened muscles, and how it is harming you. So what should be the correct posture that a female should adapt? It should be, the head should be straight, the chin should be tucked in, the shoulders should be pulled back, and the most important thing, जो buttocks बाहर निकाल के चलने की habit होती है, they keep both the hands behind and remove the butts outside. So when you're seeing a female who is coming in pregnancy to you with back pain, you first check whether she's keeping her buttocks outside in the posterior pelvic tilt, or is her tilt anterior pelvic tilt. So check that, and first thing that you should teach her is to contract her buttocks and keep the tailbone a little down, keep the knees soft, and distribute equal weight on both the legs. Okay, so this is about the posture that you should be noticing, because in pregnancy, back pain can be due to hundreds of things, but these choti small things are there that if you work upon, the half the work is already done. You don't have to actually do something for. Now, why am I focusing so much on back pain? Because I think most of the pregnant ladies come only to a physiotherapist when they have back pain, because otherwise the gynecologists don't refer. That is a big discussion that we will have, but I'll just wind this theory part a little quickly, and then we will go to that. Okay, so the primary aim of us is to achieve a healthy pregnancy, a healthy mother, and a healthy baby. And I'm not going to the history of how it started and all that. But what is our main objectives as an antenatal physiotherapist? That you should be screening fetal abnormalities. So you should be knowing how to check all the tests. You should be knowing how many vaccines are to be given, how many ultrasounds are to be done, how do you read those ultrasounds. You have to promote good muscle tone, strength, and endurance. You have to encourage a lot of relaxation techniques, which is a part of physiotherapy. And most importantly, you have to prepare her for postnatal. That means you have to work. Everybody thinks that in pregnancy you have to work only on the lower body, but you have to work a lot on the upper body, because obviously second half of her life is only going to be lifting the child, feeding the child, and a lot of upper body strength that is required. So antenatal care is always, at least in foreign countries, there's so much importance given to doulas and midwives. So I think as an antenatal physiotherapy, we, at least in India, fill in the space of this doula or this midwife, where we have to step in. The female cannot contact her doctor every day that, ma'am, I'm having a back pain today, I'm having a neck pain today, I'm having this today, I'm having that today. It is only you who she will meet every day, and you have to know how to answer her. If you're going to be blank about, I don't know what does this report mean, then it ends over there for her. Because for her, you are a doctor, and you should be knowing all the terms and conditions. And so before you start your antenatal or postnatal physiotherapy practice, so if you think 5 exercises the first trimester, second trimester, third trimester, and you can just start, it doesn't work that way. You have to go deep and start studying about everything that is given in your Jill Mental. I think that is the book for physiotherapy, and Datta, and read chapter by chapter, know every condition, understand कि किससे क्या होता है, and because so many of you will come to you with gestational diabetes, with preeclampsia symptoms. You should be knowing these terms. You should be knowing that if you are treating a female with high blood pressure or high diabetes, what are the risks, what are the things that you have to look into. So your role as a physiotherapist is treatment of musculoskeletal problems, promoting a healthy lifestyle, postural and ergonomic advice, preparing for labor, teaching relaxation techniques, and giving optimal physical strength. Now, I don't think I will go into each of the musculoskeletal problems and the treatments. I think as physiotherapists, all of you know, but I'm just going to breeze through what are the normal problems that they come with. They come with a pelvic pain, okay, in which you can give a TENS also, by the way. TENS is safe to be given in pregnancy. They come to you with a sacroiliac joint dysfunction. They come with a symphysis pubis dysfunction, in which very simple advice of just avoiding single leg stand or keeping the leg adducted is going to help you. And you have to teach isometrics of hip adductors in this case. They come to you with coccydynia. Now, coccydynia heals very well with ultrasound. So you can give a 1 megahertz ultrasound if someone is coming to you with coccydynia, 7 sittings of ultrasound, and it works very well. I know so many of you here will say that does electrotherapy really work? It does work in pregnant females. So if you're going to give ultrasound with ice packs or heat, whatever she's comfortable with for coccydynia, along with clamp exercise, it works wonderfully. Pelvic floor dysfunction. So Kegels is something that you have to teach a pregnant female, a female who has come to you pre-pregnancy or even after post-pregnancy, of how she should be taking care of her stress incontinence. I need not teach you how to do Kegels exercise. I'm sure all of you already know how to do Kegels exercise, but it is the most important thing that all of you should be knowing and should be teaching. If you, even if you don't have Kegel balls or weights, just simple Kegel exercises that should be continued in pregnancy and post-pregnancy. If someone is coming to you with nerve compression syndromes, again, you can give them ultrasounds for carpal tunnel. You can give them ultrasound for whatever nerve compression they're having. Varicose veins is again a very common problem in pregnant females. So you have to give basic, exercises, plantar flexion, dorsiflexion, elevate the legs, wear stockings. There are females who are going to come to you with sciatica. So we all know so many exercises for sciatica, you have to tell them. Now, one very important thing about when you're teaching exercises to pregnant females, please make sure after the third month, that is from second trimester, you are not going to give her any exercises which will make her lie down straight on the back. That is completely contraindicated. You cannot make a pregnant female lie straight for long, because then that is going to compress the left vena cava. Okay. Muscle cramps, you can teach her massage techniques, you can give her some calf stretches, knee pain, restless leg syndrome, uterine ligament pain. So all of this are the common musculoskeletal or neurological problems that will come to you as a women's health physiotherapist. And of course, you have to give her a proper guidance on diet as well. This again comes into antenatal physiotherapy, about personal hygiene, about the use of drugs, about alcohol, smoking, all of this. Apart from that, ergonomic advices. This is a very underrated ergonomic advice that, they just wear the seat belt however they want. But actually, if you wear the seat belt on top of your belly, it has been a research that there has been maternal deaths in UK just because of this belt, because of the pressure of this belt. Okay, so very small, simple ergonomic advices, but it is so eye-opening for the pregnant lady. Now, like I said, you cannot lie down straight in pregnancy, and you have to keep sleeping on your left side. Why is that? Anybody knows? You can put it in the chat, or you can unmute and say whatever as you choose. Why is this advice given that you should sleep only in the left? Right. So Smriti has got it, that it increases the right vena cava pressure. It will increase. Okay. So I don't know how many of, yeah, correct. Even Samruddhi is given the correct answer, right? So I don't know how many of you are aware that I have a group of reborn pregnant females. I have an Instagram channel as well, where we have 91,000 pregnant ladies with her. We have WhatsApp groups with 1,000 plus pregnant females. So they asked me one question, ma'am, I can't sleep full night on left side. What should we do? What should you as a physiotherapist do about it? Neend nahi aati hai. You can't, you practically yourself try sleeping on one side the entire night. It's not possible. So then what can be done? All of you know it will compress, right? So kya kare? So what is the solution you will give to the female who is coming to you with this? No solution. So for them, You are the godfather for them. If you can't be blank about, I don't know what to do. I don't know. If it is paining, it's paining. So if they want to lie down straight for some time, they have to make sure that they are keeping a pillow below their knees and they are in the semi-fowless position. This is the thing that you can give them. Okay, you have to show them positioning with pillows correct. So if they want to lie down straight for some time, they have to keep a pillow below the knees. They have to be in the semi-fowless position, right? You have to teach them how to roll to the sides correctly. You have to teach them how to sit properly. So whenever you're talking to a pregnant female, you should tell them, please don't slouch and sit. Make sure your bum is touching the back of the chair. That is one very important advice that you have to give them. Make sure that they are standing with proper weight distribution and not keeping their hands on top of their belly. It has to be sideways. And whenever they're lifting something from down, they have to go all the way down and pick it up and not just directly slouch from the back. Okay. Now I'm not going into the preparation of labor. So of course we have a lot of role to play in stage 1, how to use this position. I'll just show you the PPT though. This is how, the stage 1, the stage 2, the stage 3, and what all you can do in each stage of labor. So of course we do take labor management classes and everything as women's health physiotherapists. But I think this much about, we don't have so much time, so this much about pregnancy phase is okay. Now, post-delivery, what is your role? Post-delivery, breastfeeding techniques, the proper position to hold them, the ergonomic advices on how to hold the baby, how to improve the latch, how to reduce the engorgement in the breast, how to take care of her C-section stitches, how to start exercising after a normal delivery, after a C-section delivery. Now, the hospitals I practice in, so I go on a day 3 of normal or C-section delivery. For normal delivery, I start with walking, Kegels, all the hand and leg movements, mobilizations, everything. For a C-section person, you have to take it slow and you have to emphasize on the breast stretches because they are going to sag. Otherwise, you have to emphasize on the pelvic tilts because the pelvis becomes very tight with normal or C-section delivery. You have to emphasize on Kegels exercises and you have to emphasize on diaphragmatic and other breathing exercises. So ये 3-4 चीजें हैं that you should be doing when you're entering a hospital premises as a postnatal physiotherapist. That these are the few things that will come into your category that you should be solving these problems post delivery immediately. That is, I'm saying 3 to 5 days post delivery, you will be giving all of these exercises. And only after 40 days, you will be starting with core correction exercises. Diastasis recti, you can check from the first or second day. But the core correction exercises is something that you will give after 40 days. You will check their core and give them diastasis recti or core correction exercises to improve their breast strength, to stretch the upper body well, to strengthen it, and all of that. And of course, also postpartum depression comes into our, forte because you are someone she's meeting every day post delivery. Post delivery, her main concern is she wants to reduce weight, which is giving her postpartum depression. So you have to talk to her about it every day and discuss and tell her that, how she can manage it and what you can do about it. So even your counseling skills have to be superb if you're a women's health physiotherapist, because for a pregnant or a postpartum lady, mental strength is required much more than physical strength. Okay, so with that, I would like to wrap up the session because I want this. So I wanted this to be in a webinar format because instead of me talking and giving a presentation and telling you what to do, I think all of you are already CBR electives here or already physiotherapists. I would want to know from you that what is holding you back, because I see very less women's health physiotherapists in Mumbai at least. So what is holding you from practicing women's health physiotherapy, or what difficulty you're facing, or what do you want to do to start this practice? So I would want to hear from you now, if we could have a question and answers about what exactly is lacking in your practice, or what is, stopping you from practicing women's health as a stream. So the key takeaways for today, I hope you've got it, that how you should play a role in antenatal, in pregnancy, and in postpartum. Of course, in menopause as well, but that is altogether a different chapter. In PCOS as well, in urinary incontinence as well. So for a women's health physiotherapist, it is like right from the time the girl is 15-year-old till she's maybe 80, you have a beautiful role to play. That is what our role is. Okay, so I think I'll go the digital team or whoever. I think you can ask them to ask questions so that I can answer them.
Thank you so much, Reema. I think it's a meeting mode, so if anyone wants to ask question, they can just unmute themselves and ask directly.
Yeah, there is a question in the chat. They get tired easily, so how to manage?
Okay. They get tired easily because you are giving continuous exercises, which means something is wrong at your end. Okay. And problem is that most of women are scared when you say exercises. That is the amount of confidence you have to show them, that you are first of all very confident what exercise you are giving them. You have to explain that I'm giving you this exercise. So suppose you are giving some back stretches, okay? Or suppose I can say cat camel, if you're giving them cat camel. So unko obviously they are scared that this doctor is making me go on force. So you have to tell them that, this is not going to put a pressure on your baby. This is in fact going to help you in tilt the pelvis. Is say the baby will come in easily inside the pelvis, and your delivery will be easier. You have to counsel at each step. You have to explain them what you're doing. ऐसे ही बस 1 2 3 4 you can't set exercises for them. You have to explain them in detail that why you're doing, which muscle is using. It won't harm the baby. Their main concern is baby को harm नहीं होना चाहिए. So you have to be telling them and guiding them that you do this, you do that, you do this, you do that. You have to keep telling them about what they have to do. Okay. And if they're getting tired, means you're making them over exercise. You have to give a lot of breaks when you're working with pregnant females. Like for every exercise, you have to take a 5 minute break. You can't, and the room has to be very well aerated, because hot flushes or feeling hot is one more symptom of pregnancy. And you should have a washroom, and you should encourage her to drink water after every one set of exercise. Okay?
Yeah, there's also a one question like how do we approach gynecologist and convince them? So whether is it really necessary to work with a gynecologist, or we can start our own practice?
So, frankly, I'll tell you from my experience, I have approached more than 100 gynecologists. I would say not even 2 or 3 support. I'm telling this very bluntly. They do not support. They will just tell you on the face that yeah, yeah, we will send, we will do, yeah, yeah, this is very good. But none of them send. And in fact, they tell patients that you just do walking, you do yoga. There's no need of physiotherapy. They feel that you're doing yoga, no, thrice a week. बस हो गया. What is the need of physiotherapy? वो क्या अलग सिखा लेगी? This is the statement they are giving. It is, I think, our role to create awareness, and that is why I made the Instagram page. And touchwood, all the patients that I'm having are coming on their own or through word of mouth or through referral. Gynecologists do not send them. They are always going to be at loggerheads with us. जैसे orthopedic और sports physio का relation या musculo physio का relation होता है, थोड़ा सा they want to be the better one. So the gynecologists, I know many gynecologists also who are teaching breathing exercises, who are teaching some exercises, और फिर उतना उल्टा सुल्टा सीख के आते हैं, but we can't say anything to them. You just have to leave it. Okay, chalo, theek hai. But so you have to stand for yourself. You have to create your own niche. You maybe use YouTube, maybe use Instagram, maybe through your work. When someone is coming to you, even the regular patients, put some banners or something on in your clinic that people will walk in on their own. Don't rely on gynecologists. Very few newer generation of gynecologists support this, but frankly, the senior ones are not very much in favor of all this. So you have to create a niche for yourself. Don't rely on them, and don't try to convince them. You're going to waste all your time.
There's also one interesting question by Samruddhi. She says that unless and until that referral has come with a gynecologist, they think that exercising is wrong. So how do we approach these kind of patients?
Right. So, obviously, they feel it is wrong, not because they feel so. It is being told in the family. That is why I said you have to be very thorough with their report. It is wrong in some cases. Like if someone has a placenta previa, if someone has a cervical stitch or Shirodkar stitch, then you don't give them exercises at all because they will start bleeding the next day itself, and everything will go wrong, and you will be responsible. So you should be knowing how to read their report thoroughly. You should be, because the patient doesn't know कि मेरे को ये problem है, वो रिपोर्ट में लिखा होता है, which you have to find out कि उसका AFI low है, AFI high है. So you should be knowing how to read all of this and to explain to her, say, see, this parameter is normal, this is normal, this is normal, this is why I'm giving you this exercise. You just try it for 1 or 2 days. अगर आपको कुछ भी problem लगेगा, you come back to me and I will help you out. You have to develop this confidence in her. बात करके ऐसे ही she will not start trusting from के yeah, she will do it correct for me. Of course, all pregnant females are scared to exercise, but on the contrary, the new age pregnant females, they see a lot of YouTube and Instagram, and they want to do a lot of exercises. They want to be very enthusiastic, they want to take up everything. So it is your choice how you convince her. You don't have to गायना को गलत नहीं ठहराना है, पर अपने आप को सही ठहराना है. You have to give her valid reasons that why she should be exercising, how her pelvic floor strengthening will help her, how the cat camel will help her, कैसे उसको हेल्प होने वाला है, कैसे बेबी ग्रो होने वाला है. वो जब आपसे बात करके उसमें कॉन्फिडेंस आएगा, शी इज नॉट गोइंग टू क्वेश्चन यू एट ऑल.
Yeah. There is one question for Dwani Patel. She is her elective is ortho, but she is very much interested to pursue women's health in her clinic as such. So she's asking us like, uh, do she to develop those skill set of women's health? What does she have to go through any specified course to develop that skill set?
Yeah, so see, I have done a lot of courses over the years. I have done with Dr. Aditi Srivastav, I have done with Dr. Snigdha Mehta, I have done it with Dr. Shagufta Praveen, then I have done Lama's childbirth training course. So, of course, you need to do at least, I would say, 3 to 4 courses till you get that confidence and that knowledge. And of course, reading goes without saying. You have to read a lot. You have to read your Jill Mental thoroughly well. You have to read your Datta, Obs, and Gynae thoroughly well. And after 1 or 2 years of practice, it will come to you automatically. ऐसा नहीं है that today you start women's health physiotherapy and you will get confidence. Because of course, it's the most risky physiotherapy profession, by the way. Because one little mistake of yours and the female may lose her baby. It's that scary. So you have to be 100% confident and 100% sure of what you're doing. If you don't know something, tell her that wait, let me read, I will tell you, I will consult with my seniors and tell you, and then you can start of course, I am also trying to curate courses or something for the physio fraternity, which hopefully by 6 months or 8 months, whenever I start, I will definitely make the IAP team also aware about it. So that, because I see there are very few courses on women's health के बराबर से कहीं हम सीख सके के what to do, and I'll definitely try and do something like that. What care to be taken for low back pain in case of cervical cerclage? If you have a cervical cerclage, you don't give any exercises which will put pressure on the pelvis. Cervical cerclage, first of all, is given when the cervix is short and the female may go into premature delivery. Okay? So if you're going to give any pressure on the lower back, if you're going to make her do any stretches on the lower back, it is going to प्रीमेच्योर डिलीवरी होने के चांसेस है, स्टिच छूट जाने का चांस है, और बेबी टेंशन में जाके मेकोनियम स्प्रेड का चांस है. सो देयर आर मेनी थिंग्स व्हिच कैन हैपन. सो व्हेन यू आर गिविंग low back pain, you're seeing for cervical cerclage, I would say just give them TENS, just give them basic back stretches, which and isometric exercises for the back. Nothing with lifting legs or anything heavy which will put pressure on the pelvis. Where can we find women's health physiotherapy courses? So I just named a few of them. There's Dr. Snigdha Mehta, there's Dr. Shagufta Praveen, there's Dr. Aditi Srivastav. These three are taking women's health physiotherapy courses at present. But of course, they are, I won't say they're not good, but they're not. I, as a student, always felt that it's not enough to learn. खाली यू नो 2 या 3 दिन में हम पूरा वुमेन्स हेल्थ फिजियोथेरेपी सीख ले, ऐसा नहीं है. इट्स नॉट लाइक टेपिंग और नीडलिंग के 1-2 दिन में पूरा हमने सीख लिया. There are a lot of layers, there is a lot to be learned, and yeah, so hopefully I will be also trying to make some courses, but that will take time. Till then, if you want to do, you can go to Dr. Aditi Srivastav. She has an antenatal postnatal module. Then Dr. Snigdha Mehta, she has an offline module in Mumbai, and Dr. Shagufta Praveen, 3 of them. Contraindications for physiotherapy in pregnancy are many. Many is something as simple as blood pressure, diabetes, thyroid, history of miscarriages, placenta positions, AFI is low, AFI is high. ऐसे हजार चीजें हैं जो आपको बहुत thoroughly चेक करके फिर ही पेशेंट को हाथ लगाना है. How many sessions should we suggest to a patient? Many times patient comes to clinic when they are in second trimester and they are like, you teach us exercises, we will do at home. How should we plan? But that is okay. I also don't call a pregnant female every day because it is very inconvenient for a pregnant female to get ready and come down every day. So that is absolutely okay. In one session, you teach them exercises. So I'll tell you the protocol. Let them come to your clinic, teach them the exercises, let them do it for 5 days. You tell them you follow up with me for 5 days so that I can check that you're doing everything properly. But is 5 दिन में if you are getting any pain or sprain, then you let me know and I will correct that exercise for you. Otherwise, in 5 days, just come for a follow-up so that I can increase the repetitions or check if you're doing properly. And then again in another 5 days so that we can increase the set of exercises. So in every 5 days or 3 days, you can call them. Don't call them every day because they will never come. Ulta, they'll find it very gimmicky. Or आएंगे ही नहीं. Don't call a pregnant lady every day to your clinic because also you have SWD machines over there, which is an absolute contraindication for a pregnant female. She should not be coming in a room with SWD machines. Okay, so please call her in 3 days or 5 days only. That is the last.
I think, Rima, there is one more question in YouTube. Can we use electrotherapy modalities?
Yeah, you can use ultrasound. You can use TENS for back pain. In fact, TENS, I also give in the labor room when you're having a lot of labor pain, and if there is someone who can't use an epidural. Now, ये सब terms आपको पता होने चाहिए. What is epidural? What is episiotomy? So when someone takes an epidural, it is an anesthesia which is given. Then you can't use modalities. But if someone is going for painful delivery without epidural, then you can give TENS at the level of L5 S1 on a continuous mode. You can give that, and you can also give ultrasound. You should give ultrasound in case of a patient is coming to you with coccydynia or back.
I think it's done. Any more questions if anyone wants to ask?
Do we get a participation certificate from this meeting? I don't know that. Deepika, if you can answer.
No, I think. It's a free webinar.
Any other questions that anybody has to ask? How can we give visits in IPD for post-delivery movement? How can we start if we don't have clinic? So you have to go and approach hospitals. You have to go and meet gynecologists, and maybe they will not be that confident with you, but you have to assure them that what are you doing. And of course, you need to have certain amount of certifications like CBR masters or whatever. And you have to go and meet the gynecologist and tell them that let me do it for you for 1 month. You see how your pregnant ladies respond. I think I started that way 11 years ago, that you just go to the hospitals, meet the gynecologist and tell them that let me do post delivery physiotherapy for your pregnant females. You may not charge for it, but you just take the feedback for your pregnant females. And of course you have to also one of the gynecs very bluntly asked me, इसमें मेरा क्या फायदा है, मैं क्यों करूं, मुझे क्या मिलने वाला है इससे. So I'm not talking about the share, but what you have to tell them is when your patient goes out, they are going to tell the other pregnant females that get delivered in this hospital. इसमें डिलीवरी के बाद बहुत अच्छे से केयर करते हैं, फिजियोथेरेपी होता है, ब्रेस्ट फीडिंग सिखाते हैं, बैक पेन नहीं हुआ मुझे क्योंकि मुझे फिजियोथेरेपी दे दिया था सेकेंड थर्ड डे. तो ये गायनेक को समझेगा कि यार चलो इसमें मेरा कोई बेनिफिट है. अनलेस दे सी देयर ओन बेनिफिट इन XYZ, they are not going to allow you to enter their premises. So if you don't have a clinic, start with visiting some hospitals, maybe small maternity homes, not very big setups. Start entering them, go give your interviews, and somehow some you might be able to crack, and that is how you can start. I think we can. I think the questions are done. So we could.
Yes, I think. And I will request Dr. Urvi to give a vote of thanks.
Thank you, Dr. Deepika. Hello,
And
everyone. Happy Republic Day to everyone. On behalf of IAPWC Mumbai District, I, Dr. Urvi Katakia, Mumbai District Sub-Coordinator, would like to propose vote of thanks to all the dignitaries out there. Thank you, Dr. Reema Ranka, for such an informative session and sharing your knowledge on such an interesting topic. It was really an interactive session for our joinees. A special mention to Dr. Sanjeev Jha, sir, President of IAP, and Dr. Ruchi Vashne, ma'am, National Head of IAP Women's Cell. I would also like to thank to Dr. Pooja Kamble, our zonal head. Really grateful to IAPWC Maharashtra State Team, Dr. Suvarna Ganvir, ma'am, who is the Maharashtra State Coordinator, for mentoring us in the best possible ways, and all the state sub coordinators, including Dr. Snehal Patel, our joint state coordinator, Dr. Uttara Mohan ma'am, Dr. Priya Karande ma'am, and Dr. Nirali Sangvi ma'am for always supporting us. I would also like to thank all the participants for your overwhelming response for this webinar. Also like to thank our digital team for their efforts for hosting our event and making it success. Last but not least, I, Dr. Urvi Katakia, Sub-Coordinator, would like to thank my colleagues Dr. Deepika and Dr. Reema for their efforts to make this event successful. Thank you, one and all.